First, I'd like to thank Governor Wolf and his entire team for putting this event together and selecting Rite Aid as a venue. We are honored. Your early and decisive action curbed the spread of COVID-19 in our home state and undoubtedly saved lives. We all owe you a great debt of gratitude. Rite Aid is proud to be a Pennsylvania-based company that is playing an integral part in helping to end this pandemic. As a lifelong Pennsylvanian myself, I'm proud to work with the Governor Wolf and leaders across the state to provide vaccines for those in need. Rite Aid has been on the front lines for Pennsylvania residents since we first opened our first testing center on March 22nd, 2020 in Philadelphia. We've since expanded to offering no-charge testing at all Rite Aid drive-through locations. When the first COVID-19 vaccines were approved late last year, we were among the first partners with the state administering its supply right to our stores. Since then, we've expanded access by partnering with the federal government through the Federal Retail Pharmacy Program, which allows us to administer vaccines in more than 250 stores in the state, including every one of our locations in Philadelphia, many of which reach underserved communities. In total, we're now administering nearly 200,000 vaccines per week across 6 states and 2 local jurisdictions. We recognize, however, that significant barriers to vaccine equity still exist. It will take a variety of programs that reach people where they live, work, play, and worship to achieve widespread adoption of vaccines. That's why Rite Aid has launched initiatives alongside government partners to address equity gaps, including a toll-free number that provides information and scheduling opportunities at 4 locations for residents without internet access in Philadelphia and throughout the state of Pennsylvania. Collaborations with local churches and community centers to administer vaccines in pop-up clinics, and a partnership with the state of Pennsylvania to administer COVID-19 vaccinations to staff and residents of certain long-term care facilities and congregate care settings. And of course, as more doses become available, we will expand access for residents of Pennsylvania by adding to our administrating locations. For example, this week, we're thrilled to be working with our government partners to make FRPP doses available to educators, school staff, and child care providers, protecting school communities and returning students safely back into classrooms for in-person learning. It is a critical step forward to help address mental health concerns and educational disparities to improve the lives of parents and their children. Lastly, I'd be remiss if I didn't voice my sincerest gratitude to Rite Aid's pharmacists and our Rite Aid teams, many of whom are working tirelessly to administer vaccines. As Rite Aid's Chief Pharmacy Officer, I am proud to represent our over 6,000 pharmacists at Rite Aid that are truly serving a purpose to keep our communities healthy and thriving. Our pharmacists are known in their local neighborhoods and communities. They are a trusted healthcare resource, and they are truly the heroes who will help end this pandemic. Thank you so much. And now, Governor Wolf. Thank you.
Thank you, Jocelyn. Thank you very much. So thank you very much, Jocelyn. Thank you all for being here. And I just want you to notice Rite Aid has a new logo. Just want to make sure you all notice that. Again, thank you, Jocelyn. And I also want to make sure you see that Secretary Teresa Miller, the Department of Human Services, is here. And Teresa, you'll hear from her in just a minute. And I want to thank you for being here. So it is an honor to be here visiting one of Pennsylvania's many vaccination sites. And so for those of you who went inside, saw a few people are actually getting a vaccine right now as we speak. And it was a privilege for me to visit the hardworking staff who are actually making this a reality. These folks are the ones who are working day in and day out to make sure that we get as many of these vaccines into as many arms as equitably and fairly and quickly as we possibly can, because as you know, 1A is the most vulnerable Pennsylvanians, and we want to make sure that they, from the very outset, are protected against COVID. Rite Aid, as Jocelyn said, is a Pennsylvania company. They've always been a great community partner. I know they're in my hometown down central York County, northeastern York County. But during the pandemic, their employees have stepped up in so many ways to help their fellow Pennsylvanians, and their work has really been extraordinary. They opened one of the first COVID-19 testing sites in Pennsylvania way back when, and now they're an integral part of the vaccination effort. The Rite Aid is partnering with the Department of Human Services, you'll hear more about that in just a minute, to help the vaccine rollout, to make sure that we vaccinate the DHS, Department of Human Service licensed long-term care facilities. This is critical work, as the pandemic has shown us all just how vulnerable residents and staff living and working in these long-term care facilities are, especially folks in those long-term care facilities who have multiple risk factors. So we're making good progress here. But our efforts to protect vulnerable populations and communities absolutely cannot stop here. Pennsylvania's goal, again, has always been to administer the vaccine in an efficient and ethical way and an equitable way. We're working to ensure that the most vulnerable populations have access to the vaccine as quickly as possible. That has been complicated, obviously, in the early going here by a lack of supply, but that supply keeps increasing with every passing week, and more people are getting the vaccine. And it doesn't change our goal. It just forces us to identify the vulnerable populations we need to reach and figure out how to best make that vaccine available to those folks as quickly as possible. That's why when the Johnson & Johnson vaccine was approved this past Saturday, my administration and the COVID-19 Vaccine Task Force recommended that it be administered to teachers, to school staff, and early childhood education workers, beginning with those who work with the youngest and the most vulnerable children. Vaccinating teachers and staff is going to help protect schools and students, and it's going to help us get our kids back to school, back into the classroom as quickly as possible. As you all know, this initiative includes early childhood education workers and child care workers in addition to K through 12 educators. However, we know that many community-based early childhood education and child care workers do not have a formal connection to any school district. And we refuse to allow the most vulnerable segments of our child care workforce to be missed on this account. And that's why we're working with pharmacies through the Retail Pharmacy Partnership. That's the FRPP, right? FRPP, if you heard Jocelyn say, is the Federal Retail Pharmacy Partnership to ensure that all early childhood education workers have access to the vaccine, no matter where they work, no matter what their connection to the public school system. The Retail Pharmacy Partnership is going to receive its own allocation of the Johnson & Johnson vaccine directly from the federal government. I think in Pennsylvania that's to the tune of 30,000 doses, which is separate and above the Pennsylvania allocation, which is 94,600. Rite Aid, Topco, and Walmart have agreed to use their Johnson & Johnson vaccine allocation to give child care workers who provide, again, an essential service to working families all across Pennsylvania the option to get a vaccination. We're working out the details of this program right now. We'll have more to announce in the coming days so that we won't delay the ensuring that every one of those working with our children will get the vaccine soon. So I'm proud of what we're doing to protect vulnerable populations in Pennsylvania, but I'm grateful to have a strong partner like Rite Aid to vaccinate Pennsylvanians as swiftly as possible. So again, I want to thank you, Jocelyn, Rite Aid, all the employees who are doing such an amazing job for their hard work and their commitment to serving Pennsylvanians. Now I'm proud to turn this over to the Secretary of the Department of Human Services, Secretary Teresa Miller.
Thank you, Governor. Thank you so much, Governor, and thank you, Jocelyn, for hosting us today. I cannot say enough what an incredible partnership we've had with Rite Aid in the last few months. As Governor Wolf said, I am honored to serve as the Secretary of the Department of Human Services. And DHS's work casts a wide net. We administer our public assistance system that helps millions of Pennsylvanians access health care, helps them feed themselves and their families, heat their homes, and meet other essential needs. We oversee our child care industry and license and oversee services provided in long-term and congregate care facilities serving older Pennsylvanians, people with disabilities, and people with behavioral health needs. This work extends across the Commonwealth, covering nearly 1,200 personal care homes and assisted living facilities, 5,500 community group homes for adults with intellectual disabilities, and hundreds of other facilities representing other levels and types of care. These service providers play a crucial role in systems of care for our parents, grandparents, and other loved ones who may not be able to fully care for themselves on their own. In many cases, these are our loved ones' homes. We know that the COVID-19 pandemic has created difficult circumstances in long-term and congregate care facilities. COVID-19 can unwittingly enter these facilities through asymptomatic transmission, and we know how dangerous that can be in settings that primarily serve people who are older and may have coexisting medical needs that can be complicated by COVID-19. DHS and our partners across the Wolf administration have worked throughout the last year to help these facilities so they don't have to face this pandemic alone. Through a long and challenging year, we're finally at a point where we're able to fortify a line of defense against this virus and provide a much needed reprieve to residents and staff of these facilities, as well as their loved ones who have likely experienced a great amount of stress and worry in the last year. Vaccinations are our best line of defense to keep all Pennsylvanians, particularly those who are most vulnerable to serious cases of COVID-19, safe from this virus so we can overcome this pandemic and move forward together. Vaccinating residents and staff of long-term and congregate care facilities, people who are most often at risk of a severe case of COVID if exposed, will protect our most vulnerable residents and hopefully reduce the size and severity of outbreaks that have challenged congregate care settings throughout this pandemic. Many of our personal care homes and assisted living residences receive vaccinations for staff and residents through the Federal Pharmacy Partnership. But not all facilities were enrolled in this program. And beyond that, not all of the facilities we oversee were eligible for vaccination through this process. Because of this, we needed a solution to help effectively connect our other facilities that did not have a plan for vaccination to a vaccine provider. Our partnership with Rite Aid was born from this need, and Rite Aid has been an incredible partner and an incredibly nimble partner since we launched in January, helping us administer over 12,000 first doses to residents and staff across more than 1,700 facilities. In addition, we've had over 2,500 second doses administered. This progress is a line of defense for long-term care facilities that have been particularly challenged by COVID-19 and community transmission that can increase the likelihood of outbreak in a long-term or congregate care setting. And on a larger scale, it's a reprieve for our healthcare system as a whole. I cannot thank Rite Aid enough for their partnership and their quick work to help us reach and protect people served in DHS facilities. And I'm grateful that we're going to be able to continue working with them to help our staff in child care facilities across Pennsylvania get their vaccine. These dedicated workers are on the front lines caring for children whose parents may have to work outside of their homes. As we work to help our economy recover and get parents back to work, we need to be sure that our child care industry is safe and protected so more children can return to care. I'd also like to just quickly acknowledge the extremely dedicated staff in DHS, like our Chief Innovation Officer, Dr. Doug Jacobs, who's here, there he is, who's here today, and so many others who have coordinated this partnership and outreached to thousands of licensed facilities to help connect them to this option for vaccination. There's still much to be done to overcome this pandemic, and we all have to continue to do our part, wearing our masks and reducing the risk of exposure and transmission. But we are making incredible progress, and these partnerships will save lives. That makes me hopeful, something that I haven't felt a whole lot of in the last year. but I hope that's something that we can all hold on to and continue to keep ourselves, our loved ones, and our communities safe. Thank you again, Governor Wolf, for allowing me to be here today with you, and I'll turn it back over to you.
If you want to say something too. Okay, we'll take questions. Yes. I think she get her. I got the microphone here.
Okay, Republican leaders in Bucks County.
You want to give her the microphone? No.
No, just get to make so we can hear her.
Give her. Thank you. There you go.
Okay, Republican leaders in Bucks County are introducing legislation to have doses distributed by population because they say they're being shortchanged on shots. What do you say about what they're claiming, and also would you support that legislation?
Well, in terms of distributing by population, we're trying to distribute it according to the most vulnerable populations. We're following the guidelines for the federal government, the 65 and older, people with underlying conditions, and now teachers. If that works out to be what the population distribution across the counties are, that would probably be an accident, but eventually, as everybody gets vaccinated, it will be exactly where each county is, but I think that that would be working at cross purposes to what we're trying to do here. Now, having said that, we're looking at that and making sure that we're doing, getting the vaccines out in the way it's meant to be according to the priorities that we've established, and we'll have a perfect, I think, well, I don't know if we ever get a perfect one, but we'll have a much better sense of how we're doing in that regard in the next couple of days. We're researching that right now.
I do have a follow-up too. Colleges and universities have to teach throughout the summer. Is there any plan to add them onto this early vaccination for the Johnson & Johnson vaccine?
Yeah, not at this point. At this point, we're looking at the early child care, pre-K through 12th grade. Yes.
Can you and perhaps Jocelyn shed some light on how this Rite Aid fits in terms of reaching underserved populations? And I'd like to get a sense of how much vaccine is available here. And I assume the people we saw waiting today had been on a waiting list, but I'm trying to get a sense of how much vaccine is available through a site like this. And also, is it just the Johnson & Johnson, or are there others brands available here? Thank you.
Okay, now keep in mind I'm an older person here, so I might forget some of your questions.
I'll
here,
remind you.
Yeah, you remind me. And Jocelyn, I'll let you deal with the Rite Aid questions. But in terms of where Rite Aid fits in general, we have tried to figure out, as we roll out the vaccines, how to have a footprint that actually connects with as many Pennsylvanians as possible. That's in the rural counties, the urban counties, and so Rite Aid has an amazing footprint. They also have a great logistics expertise, which is really important because this is in part a logistics challenge to get things out there. So they're part of that. But in terms of that leaves people who can't get to a Rite Aid, who we didn't see here, who are here to get their vaccine, and so we still have to work out how we might do a better job there. I think the National Guard is a possibility. Mobile sites that may or may not be something that Rite Aid wants to do or can do. And then we also have mass vaccination sites, which will be carried out, who knows how at this point, but the National Guard will probably be involved with that. So we have a lot of different channels that will get out as we get more and more vaccines. Right now, the challenge is to get to as many vaccines, first and second doses, into the arms of folks who are going to be who are in that 1A category or most vulnerable. The Johnson & Johnson channel is a new one, and that just came out this week. Again, if you add the partnership with the Pennsylvania allocation, about 124,000 vaccine doses. That's a one-dose vaccine, and it's going to allow us, because it's one dose, to actually get our teachers back to school, which is why the bipartisan COVID task force figured this would be a really good thing to do, to make the Johnson & Johnson and focus that on that channel. And again, Rite Aid is using their federal partnership voluntarily to say, okay, we'll do that. I mean, the president has said he wants to make education a priority as well, but Rite Aid is stepping up along with Walmart and CVS, Topco to actually make that work for teachers. So this is a separate string here to try to get to our educators and to get kids back into the classroom as quickly as possible. Now I'm going to turn it over to Jocelyn for you have to ask the question about Rite Aid again.
Some light on how much vaccine is available from this particular Rite Aid, which is in a place where, I imagine there's a lot of people in this general community. It's probably very convenient, and I'm trying to get a sense of what the level of access is right now.
Yeah, at this time through the federal program, our allocations are overall small. So a site like this will only get 100 doses per week. So we're doing about 20 shots per day for dose 1, and then obviously once dose 2 is available, we'll get a second allocation for that. So in essence, right now we're getting 200 doses per store when it's dose 1 and dose 2 simultaneously are happening. But that's throughout most of our stores in Pennsylvania will have that allocation.
And about how many are there in Pennsylvania?
What is our number? Sorry, guys.
Roughly.
What's that? 190 currently.
Okay.
Yeah, get that allocation. So, and that is all through our scheduling tool, which is at riteaid.com. And we're utilizing a scheduling tool, which creates an eligibility qualifier. So you have to qualify first before you can actually schedule a dose based on the state's qualifiers.
Thank you.
Okay.
And just to give you some sense of magnitude, this week we received in Moderna and Pfizer, the state, not counting the federal partnership, and not counting Johnson & Johnson, we received about 450,000 doses.
And that's first and second.
Yes,
450
yes.
First and second.
The combination, yes.
Got it.
Yes.
Thanks.
So, Governor, I was talking with the folks that you had bumped elbows with there inside the pharmacy, and they had said that, like a lot of folks, they had some difficulty booking the appointment to begin with.
Right.
What they had said was we had to be very persistent
Yes.
to get this appointment to begin with.
Yeah.
So my question is, with this patchwork of registration systems, there's been a lot of talk about maybe a statewide system. But leaving that aside, what's being done to help streamline the access to appointments, especially for folks who don't have computers, who might be not as digitally literate as some other folks? Your thoughts?
Yeah, I'll turn that back to Jocelyn. But I think each of the ideas, and again, we want to make sure that we're doing this as conveniently and quickly as possible. But my sense is that groups like Rite Aid have really figured out how to get online. Now, the supply continues to be a problem. If everybody were doing things perfectly, which I don't think anybody would say any of us is doing this perfectly, but we still have a problem with not enough supply. The federal government is doing a phenomenal job of making that, increasing that every week, but we're still not at a point. I think the president said we'll be at that point maybe by the end of May, where everybody who wants a shot can get one. But we're not there yet. So the question is, how do we make this, work as well as we can given the constraints that we're working under? And I think Rite Aid's doing a phenomenal job.
So we're taking a multi-pronged approach to this. So we do have the scheduling tool, obviously, so we don't have masses of individuals coming for 20 doses a day. So that is our first attempt at scheduling folks with the allocated doses that we have. In certain locations where we get Pfizer, we have actually more doses. We're not getting a lot of that. However, in those particular stores, I believe we have 9 sites in Pennsylvania. We're using both the scheduling tool, and then we're utilizing extra doses, if you will, or doses that aren't scheduled. And we're actually going out into the communities and doing clinics at churches, at care centers. So we're utilizing that approach as well. And then in 4 sites for those Pfizer clinics or Pfizer in-store clinics, where we're doing 200 shots per day. In those clinics, we also have an 800 number that individuals can call. It's challenging as well because everyone wants to get their dose, but we're trying to meet our customers where they are and based on what they can do. And in addition to that, in those Pfizer stores where we have more shots, we're allowing walk up, and we are helping customers actually schedule if they don't have internet capabilities. Our stores are helping those customers schedule as well. So it's, go ahead.
I guess my follow-up for that is, I mean, so I understand correctly, you say 20 shots a day. Is that like 20 appointments a day?
20 appointments a day.
Okay.
It's very small. So as the governor stated, it's a supply issue right now. So 20 is not going to actually, support this community yet. But when we get the doses, we'll have more access.
And in terms of logistics and manpower, this is the absolute max you can do right now.
I'm sorry, what was that?
In terms of logistics and manpower at your various stores, this is the max you can do right now, given what you have.
No, we're doing 40 right now at this location. And similar to what we do with flu, I mean, we can do that in our current workflow. Obviously, when you're doing 200 shots a day, that's a different model for us, and we're bringing extra staff and extra pharmacists in to do that.
Thank you.
Okay, thanks.
Governor, I believe, if I'm not mistaken, tomorrow is going to be the one-year anniversary of the first cases that were reported by the state. I don't mean to put you on the spot because I know it's kind of a heavy question, but can you offer some thoughts about the last year?
Yeah, no, I just actually taped a video to go out to commemorate the 1 year. This has been a tough year. I'm not sure that there's anybody in Pennsylvania who isn't frustrated, sad, maybe even grieving for a loved one who's been lost. We're all frustrated, the fact that we can't be social, the social animals that we are. We can't be with our families the way we were before the pandemic hit. There's a lot of sadness. At this point, though, we have something we didn't have a year ago, and that is hope. There is I hate to keep using this term, but there is a light at the end of the tunnel. We just saw it right here. And these vaccines are rolling out, and I am on a weekly call with all the other governors and the White House. And they're doing a phenomenal job of getting more and more out. They're actually under-promising and over-delivering, which is really an amazing thing. But this has been a really trying year for all of us in so many different ways. And I think the thing that I came back to Pennsylvania, I'm a native Pennsylvanian because I'm really proud of this Commonwealth. I've never been prouder than I have been this year. We have shown each other and ourselves what we can actually do. So it's been a tough year. We have reason for hope, but also it's been an amazing year in terms of showing ourselves what we're made of.
I may just follow up one question. I know the CDC statistics have put Pennsylvania down toward the bottom, I believe, on percentage of shots administered, I guess based on the stock that the state is receiving. Can you talk about efforts to try and improve that ratio?
That is exactly what we're doing. I mean, maybe it's the second thing we deal with on the agenda at every one of our COVID task force meetings. We're trying to get the vaccines out more quickly. So I think what you'll see is that we are moving up in the ranks. The latest, as of yesterday, we were average in terms of, if you look at, that depends on the metric, but the percentage of the population who've received one dose, I think it's 16% nationally. We're about 16% here. We're a little bit below the national average in terms of the second dose, but we're getting closer, and we need to do better there. And the CDC one is basically just shots in arms. I think they're at 77%, we're like 70%. So we used to be way down, now we're getting closer. So we're getting better, but we're not where we need to be yet. But that's exactly the question that we're asking. How can we get up? How can we move up and do a better job? Yes.
So in terms of the 30,000 extra doses of J&J, can you clarify a little bit about is that going directly toward the early child care, and the rest of the 94,000 is toward more of the other educators? Can you clarify that a little bit?
Okay, first of all, this is complicated. It's complicated for all the states too, because the federal government basically has its own connection with this in this federal pharmacy partnership program. And so we don't know a whole lot. So what's been nice about this, we've gone to the pharmacies like Rite Aid and said, listen, and the president has said, we really ought to prioritize getting our kids back into the classroom. How can we do this? And we need to make sure that teachers feel safe. And that's not just the K through 12 or even pre-K through 12. It's all the way, everybody who's taking care of kids. Working families need that. So we went to these 3 organizations and said, could you volunteer? You don't have to do, I'm not sure what the deal actually is between the federal, these private companies and the federal government, but that 30,000 could be really helpful in making us go faster. And how about if the tranche that you take is the early childhood group of teachers and staff, and they said, yeah, they'll do that. So, do you want to say anything about that? It's really, it's voluntary, and they have stepped up.
And similar, because it's a one-shot dose, it makes it really easy for us. And I say easy because we do this. Again, I'll compare it to flu shots. We'll go out to schools. We'll go out to care centers. We can immunize teachers in that location, especially if they are on site. And we can do it very quickly and navigate through that process based on the supply that we have.
So where are you in that process? Is that the goal to go to certain schools or to have like a separate sign up for these educators and early childhood educators?
Yeah, so we'll do this outside of our scheduling tool, and we'll work directly with the teachers so they don't have to get challenged, as many of you have said, through a scheduling process. And we'll go directly to them, schedule the appointments, and go directly to them. Or even if we do it in our own store, we'll work with the teachers or the child care centers and see what works best for them. Okay.
Hey, Governor, I kind of wanted to piggyback Tom Lehman's question. He had asked you about reflecting on the past year. The President of the United States constantly gets asked, when are things going to get back to normal? You're kind of seen as the pandemic response face for Pennsylvania. When do you see things returning to normal? Have you really kind of eyeballed a time frame for that?
Yeah, well, as you know, this week we actually took and relaxed 3 mitigations: the indoor event caps and the outdoor event guidelines went to 15%, and the indoors 20% outdoor, and then out-of-state travel. Now we've lifted any limitations on that. I want to get back to whatever the new normal is. I mean, we're going to be, we don't know exactly what that is, but I want to get back to that as quickly as anybody does, and I want to do it safely, and I want to make sure we're doing this in the right fashion. But the vaccines, again, the president said by the end of May, everybody who wants a vaccine will get one. I don't know how we actually get to that, but if that's true, we're looking at sometime at least by then. And between now and then, we need to keep doing what I'm doing this week, and that is relaxing. I want to be cognizant of what the CDC is saying and the federal government saying, let's not take our foot off the gas pedal too quickly here. Pennsylvania has done a remarkable job. I think the nation, the numbers are, in terms of the incidence of the disease, we have a 40% capacity and excess capacity now with our hospitals. 8 weeks ago that was down to 10%. We're making some real progress, and it keeps getting better each and every day. But it's sort of like, I think of like a marathon, and you don't want to go through the marathon and then 100 feet from the finish say, okay, the race is over, let's just stop. No, you run through the tape, and that's what I want to do here. Make sure we do a good job. The end is near. The light is coming at the end of the tunnel. There's every reason for hope. It's a cold day today, but the warm weather's even coming, and so we are going to be in a position to lift these. I want to do this responsibly and reasonably, and I think so far we've done that. Okay. All right. Thank you very much, everybody. Jocelyn, thank you again. I'm a Rite Aid guy. It's red, white, and blue down his hand.
We're just saying we rebranded. You like it? I like it. It's nice and fresh. And, permits, et cetera. No, it was just fun. We've been doing this since November of this year. 2,446. It takes a little bit of time, yeah.
That's what I was doing constantly.
Even though they may be small.
Hello. Okay. Good. Thank you. Have a good day.
vaccine too?
Yeah, I got mine about a half hour ago. My first one. Yeah,
Was that your first?
Oh, did they call you?
yes, my first one.
You okay?
So it's a new process for them, but and then Sonia, you want to share
Oh,
with them
yeah.
where this is what the
So
our
this is what we provide the patients when they come in. This is just some info. So we provide it for them so they can bring it back with them already filled out at their convenience.
So how do you keep track of who gets first and second and what because one's 3 weeks, one's 4 weeks.
So in this location, we're only doing the Moderna vaccine. So the customers that would come through our schedule, we would only be providing them the 28 days.
So that's 20.